Hello, everyone. Thank you so much for joining us for our monthly interview. I am so pleased and honored to have Dr. Jimmy Roberts with us, a practicing pediatrician in University of South Carolina Medical Center, and Leyla McCurdy, who's been a longtime colleague and advocate in children's environmental health with us. They're both board members for the Children's Environmental Health Network. Jimmy is our board chair and Leyla is our treasurer, and both have been good friends as well as colleagues for well over 2 decades now, which is pretty phenomenal. I remember meeting Jimmy when I first started at the Children's Environmental Health Network in July of 2000, and I was charged with being the staff lead of the education committee at the time, and Jimmy had been on that committee for a while. So not only have I been learning from you, Jimmy, for many years, but it's been an honor to also, hopefully make some good work happen together. And of course, we've advanced a lot since that committee work. And Leyla, I think you also were serving on that committee in a different role with a different nonprofit at the time. And then, of course, we've seen each other all over the DC metro area. We're long-term members of the American Public Health Association together and have just, I think, had a very natural partnership and friendship as well developed. So it's an honor to have the two of you. We've only had one other interview with two folks. It was Gail, our other board member, Christopher, and Heather, her daughter. So it's great to kind of change the format up a little bit here. So thank you both for joining us.
Thanks for having us.
Yeah.
Yeah, this is a great pleasure and an honor. And of course, Jimmy and I have been working together during that time as well. So it's a three-way partnership. And
That's right. Even before 2000, Leyla and I were working together.
Yep. Yeah, I thought it would be quite a nice synergy here because we have a practicing pediatrician who also has been working very hard to translate science into action, whether that's in education and practice, even policy. Many of us have taken some of your work, Jimmy, into policy discussions. And Leyla, you know well, the science, taking that science and translating it, and also working a lot on equity and climate change and you name it, making sure that children's environmental health is at the forefront of all that we do. So I thought it would be a nice blend here about not only the partnership that you all have had, but also I think lifting up the synergy and the benefits of what academic, practitioner, public health, clinical partnerships actually do. If more of us could be doing this, I think children overall now and into the future will only benefit greatly. So please bring those examples out and those case examples as we have this discussion. So I was hoping, especially if folks are meeting you two for the first time, it maybe possibly could happen. But if you all could share the journeys that have led you in your professional careers to becoming, in my mind, two of the most premier children's environmental health advocates in the field. Leyla, if we could start with you.
Well, thank you, Nse. This question is quite profound for me. And I feel like this is a natural expression of who I am. Even as a child, I always cared deeply about vulnerable people and wanted to stand by them and help out. I always say, I was a pretty good student in school and stuff, but the only time I would get into trouble was when I stood up for somebody who was being mistreated. So I think it's in my soul, and I've always loved children. So in the 90s, this is getting back to 3 decades now. When I started working as the director of indoor air quality at the American Lung Association, it was pretty obvious to me that we had to protect children first because they are the most vulnerable. And I felt strongly that, which is pretty much proven today, is that when we protect the most vulnerable, we are protecting everybody else. So this is something that I carried with me throughout my career, always put children first.
And that you certainly do. I can attest to that, Leyla, and we're so pleased. I'm sure there are many different ways your career path could have gone. I know you had some corporate experience as well as nonprofit experience, and it's also valuable, and I know it makes you who you are. And thank you for bringing in even some of those childhood experiences as well. And Jimmy, how about you?
So mine was a little bit more of a, I guess, off the beaten path. I, of course, did a pediatric residency, and during my time in residency, I had a patient with lead poisoning, and we had to chelate the patient, which kind of got me interested in some of the toxicology type
Mhm.
issues with pediatrics. But I never really thought about where it might take me in my career. And then I decided to do academic general peds. So that brought me to a fellowship in general peds. And of course, we have to get some projects going. And a friend of mine said, well, we could probably do something with lead poisoning in the state of Alabama. I was in general peds fellowship at Birmingham at the time. And so I got interested in looking at the lead screening throughout the state. Got to meet Dr. Rout Reigart, who was the chief of general pediatrics. And he also happened to be the chair of the board of Children's Environmental Health Network at the time. And so he invited me to a meeting. And that was when I was interviewing for a job on faculty. So from there, Rout just opened up many doors for me. Met a lot of people, got a lot of opportunities. And from there, I started working on a book with him, Recognition and Management of Pesticide Poisonings. And that led to meeting Leyla and working with our pesticide initiative. So I think part of it is being open-minded to what interests you, but then also looking for, opportunities and meeting other people. And when you make those contacts, amazing things can happen.
Yeah, that is very well said. And I know when I was just getting my feet wet at CEHN, I certainly relied on the pediatric and asthma guides that you all worked very hard on providing the science for and also the case examples for. And I would say some of that even went into some of the additional updates that we made to the children's environmental health, putting into practice environmental health curriculum as we continue to update it, which you all have been involved in as well. So I think these resources and these partnerships, again, as Jimmy said, when well done, they live on. The legacy of that work lives on. And look, these are just 2-3 people here. For those of you out there looking for things to do, there's always a way that a nonprofit like CEHN can keep you busy and put your expertise to work. So in case you're ever wanting to know, just reach out and we'll be sure to have that discussion with you. So you are also both parents, and Leyla, you have the benefit of having 2 beautiful grandchildren as well. Jimmy, you have 2 sons, and Leyla, you have 2 daughters. Many of you know I have 4 children, 2 sons and 2 daughters. And I think we would be remiss to not acknowledge and appreciate what parenthood also does to us as human beings, and hopefully further enlightens us and opens our eyes to things that maybe as single or even married people without children may be a different perspective. Please share any accounts that you have on how becoming a parent, and in Jimmy, your case, you see parents all the time in practice. How has this shaped or maybe further enhanced the work that you do in this field?
Well, I think naturally you end up being a better pediatrician when you're a parent. And I think that when you look at issues that relate to children, you tend to look at your own children first. And it's like, how will that affect my children? And I guess, too, when you think about the next generation, it's like all the things that you're working on, this may have a long lasting effect. And you want to make sure that you leave the world a better place than where you started. And so I guess that sort of is that philosophy of why I like a lot of the environmental issues that affect kids today.
That's excellent, Jimmy. Thank you. And Leyla, how about you?
Of course, I agree with Jimmy, as usual, most of the time, let's say. So well put. I think it's a real privilege and outstanding joy to have the great, I think, gift of being a parent. It teaches you so much, and it is really day to day. Not that it doesn't have its challenges, wait until the teenage years, but it opens your mind to a really a broader way of looking at things, and really become even a more caring person and really thinking about their future. And one of the joys of, I think, having your own children, and especially having grandchildren, you rediscover the world through their eyes. It is such a wonderful feeling, with a little, especially, with a grandchild. Um, you've gone through a lot of things, and now you're maybe rushing through life. You've set certain habits, not seeing things around you, appreciating nature so much, maybe. And then those little feet stop by a little bug or a little piece of leaf. They are just so curious to find out what that is. You stop with them because you have to keep pace with them, and then they'll look at you and ask you questions. So they help you to rediscover the world and appreciate the world. And I think gives us even more passion to protect them and to protect our natural environment.
Oh, that's a beautiful account, Leyla, and so true. The innocence, and as well as the incredible depth that children have that I think a lot of times they're not giving credit for, right? By helping us all have those new lenses of the world. So thank you for that. So transitioning from the beauty of young children and the growth of children to life in a new administration, at least here in the US, it's been quite a year for us on many levels. COVID and schooling from home and working from home and trying to all stay safe and healthy. And in the midst of this, we had probably the biggest potentially presidential election of maybe my lifetime, as far as numbers of people voting and all the attention. With the new Biden-Harris administration that's now, at least by our taping, over 100 days, there's a lot to cover. And a lot of us here in the children's environmental health field have been monitoring a lot of things that didn't go as well in the last administration, especially curtailing public health related provisions and EPA regulations being rolled back. I mean, there's a lot of work to do to kind of get us back to a footing where many of us would say we were prior. There's a lot, climate change, injustice, again, the impacts of COVID, mental health wise and beyond, as well as the regular environmental health hazards that we all track and work on. Where might someone listening, a rising student, someone that's trying to emerge into their professional career, but trying to figure out what niche of this field might be of interest to them, and or those that are trying to get the attention of this new administration, what might be just a few priorities you might have for where one may start? Leyla, would you like to start with that?
Yeah, I'll just say a few words. I have to say I'm very, very excited, like we all are, in the public health and environmental health field, having gone through the 4 years of struggle. And now I think the topics that are being discussed are things that we've been working on very hard. I do agree with the Biden priorities, like as you mentioned, COVID, climate change, injustices, and equity issues. And of course, that all ties to economy. That's a reality too. And I think there are great steps that are being taken by the administration and as the environmental health community. I think what we may want to think about is inspire others to really putting children first. Again, as I said, everybody cares about children, or at least they pretend to. I'm referring to some of the political games that are being played, but I think everybody deeply cares about children, and these topics impact children more than the rest of the population because they are vulnerable for a variety of reasons. Their organs are developing, they are closer to the ground, and they have other vulnerabilities due to some of the social situations they may be in, like poverty or coming from communities of colors, a variety of things that impact our children who are so vulnerable. So, and again, as I said, we need to put them first. And when we protect them, when we pass legislation or take steps to protect children at all levels, we are also not only giving them the future potential that they deserve, they are these standards and regulations or any steps that are taken will also protect everybody else. So my point is, let's all put children first and take steps to engage with our policymakers to make sure that they are protected. Climate change is really looming over us, and it impacts children more so than others. And many of the steps that we take to control climate change will also impact and control and reduce some of the other environmental health risks, such as air pollution. So I would say if anybody needed to choose a topic, I would say choose climate change, climate justice, and children as being right in the middle of that.
Thank you, Leyla. Those co-benefits are truly so there for us to just take advantage of the health, the equity, and the economic benefits to protecting our collective health, and of course, uplifting the best of our environment for sure. Jimmy, do you have any other points to add on this?
Sure. Yeah, Leyla had a lot of things to say about child development, which I think are so important to think about. Talking about kids who are crawling around on the floors, that's how they explore their world. That's how they also end up getting some exposures. So lead, pesticides, again, those are important issues for kids. I like how you said put children first. Let's do that. I'd really like to see them do something with TSCA. That law is needing to be strengthened in terms of looking at a lot of chemicals out there that I think are past their use, and plenty of evidence to show that there's some dangerous ones out there that probably should be removed. So I think that there's a lot can be done. I think, again, the other part of it is that I'm so concerned about how divisive we are. There's always one side and another side, and let's look at it in terms of each polar opposites. If each polar opposite wants every single thing, and we don't meet somewhere in the middle, nothing good is going to come out of this. And so, as you said, everybody loves children, and let's put them first. And I think that could really drive where we want to go as a country.
Yep. Thank you so much. I've been in a variety of meetings where we knew that there are many folks that had very extreme views of the world, but a couple places where collectively folks knew that they could find common ground were protecting the current generations and future generations. Yeah. And if we can just stick on those, and there are others, but that was a very huge one. And that shows up a lot, poll after poll, or even looking at climate change or what have you. So we need to garnish, I would say, the political will, figure ourselves out, think about our investments. Investment is not always just money in a community, right? It's time, it's energy. It's what you all are doing right now as volunteers for the general public to better inform, and I would say demystify any myths out there and deal with the science and the facts. And I appreciate your points very much. So I invited you all to join me today because I've known you, as we talked about earlier, for many, many years. And I also have found the partnership that you all have had to be quite, not unique, but very special. And I just wish that we saw more of these type of academic practice, public health education, and advocacy type of partnerships emerging, because I truly do believe that it's part of the larger systems approach, the paradigm shifts that we all know need to happen in the daily lives of so many, starting with just the US. I was wondering if you could share an example where your collaborations together have helped to advance the field of protecting children from environmental hazards. Jimmy, do you want to start?
All right, sure. So this way I get to list out some of the big ones that we did and choose one. So we worked on the pesticide initiative that I said earlier. We worked on an asthma initiative, on asthma guidelines in terms of managing the environmental hazards for your asthma. And we worked on back to nature guidelines, a paper that really talks about how kids can get out to nature. So I'm going to pick the asthma one just because it has a little bit more clinical activity for me, but I think all of them are important. But the asthma guidelines really help, I think, fill a niche where we talk a lot about managing kids' asthma with the medications that we have, but fewer physicians and nurse practitioners are as aware of some of the environmental management aspects of it. So we talked a lot about the data around dust mite control, cockroach control, various other outdoor exposures, indoor exposures that can worsen your asthma. And we taught a lot of people, a lot of healthcare providers about how to better manage our asthma. And I think that's one of those initiatives that's really longstanding, and I think will last the test of time, I hope.
Thank you, Jimmy. And Leyla?
Thank you, Jimmy. And of course, we have a lot to share and we need to have discipline not to go on and on, right, Jimmy? And I'll just touch upon, some of the key points of the approach, which I think could serve as a model in the sense that with the like the asthma initiative, and we started with the pesticides, and then the model was to bring together a large group of stakeholders around the table and put a team of experts together to create these guidelines. And so that helped in many different ways. One was, of course, we tapped into the best experts in the field and the government agencies and others who were players in this field. And it also, I think, led to buy-in from the beginning. We had, a peer review process in place. So when we had published these guidelines, they were well embraced by the key organizations like the American Academy of Pediatrics in the case of asthma guidelines. And we didn't leave it at that. We didn't just publish something and let it sit on a shelf. We had a strategy to really incorporate it into healthcare providers' education and practice. And we created a initiative called Environmental Health Champions. This would be pediatric asthma champions. So we had trainings to train a cadre of pediatric healthcare providers and ask them to train their colleagues. And not only that, but incorporate it into the curricula in their academic institutions and integrate them into the electronic medical records. So through this initiative, we created tens of thousands of actually what we call faculty champions. So we applied the model to, you mentioned the Nature Initiative. We applied the same model to an initiative that encouraged families and children to spend more time in nature for the physical and mental health benefits. Again, here we started with the evidence. We actually looked at the literature and published a paper which helped for buy-in from the medical and public health community. And we created a prescription for pediatric healthcare providers to write prescriptions to their patients. And again, through this, we did several trainings in a variety of communities as well as webinars. And we were again able to train thousands of pediatric healthcare providers who are implementing this, getting kids outdoors in nature. And just recently, actually, this is a really important topic during COVID, especially, we are all trying to find ways to sustain our mental health and also physical health. We can find all that in nature. And so we, as the American Public Health Association's Children's Environmental Health Committee, which I chair, just recently released a fact sheet about the health benefits of nature. So I guess my point is, if we work together, we can create really very credible and practical tools that can be incorporated into our healthcare and public health system that can really advance children's environmental health. And it has been a real privilege, Jimmy, to be working with you. And of course, CEHN has always embraced these tools, and they are part of the curriculum that's on our website right now, right?
Yep.
What do we call that?
So putting into practice.
Yeah. And I invite people to take a look at it. These tools are on the CEHN website.
Thank you so much, Leyla.
I got to point out too that paper that Leyla was talking about that she wrote, I helped her with it, but she really wrote it all, and that has still gotten a lot of citations in the literature. So that's a 15-year-old paper that people are still citing and writing about. So it was a really landmark paper, I think, that Leyla wrote.
That's right. And it just goes to show, years and years are passing, and yet a lot of the same evidence is still very relevant today, and so much available for us to lean on for best practices and to be using as part of our toolbox, as we call it, in the advocacy arena for any influencers or any community type of change that we're aiming for with science behind us. So thank you for that, Jimmy. So delving into pesticides a little bit more, by the time of this taping, the US Court of Appeals just recently of the Ninth Circuit had just found that EPA violated the law by keeping chlorpyrifos, a known harmful pesticide, on the market without finding that the pesticide is safe for children. So the court has ordered that EPA either has to modify the allowable amount of this pesticide concentrations on food and find that the modified tolerances are safe, or banned the use of chlorpyrifos altogether. And I can tell you, those of us that work with the strong pesticide advocate community definitely want the latter to happen, ideally. But with all that said, this discussion around pesticides as a whole, lots of different routes of exposures. As you all have talked, you've had lots of experience in this. What do you think this time may lend for us? Might we be seeing some windows of opportunity when it comes to trying to make some real progress in protecting, in particular, vulnerable populations like children from harmful pesticides in the US? Leyla, do you want to start this time?
Well, sure, but I defer to Jimmy to talk a little bit longer about the science and his thoughts, because he's definitely a great expert on this, and I know that because of all our work together, and he's well published in this area. So there's no doubt that these things harm children, and I think this is a great move. If it weren't the type of administration we had, the 100 days prior, this pesticides would have been banned anyway. We thought it was gone, and it came back. And so many of us in the public health community are, have been fighting for this. I served on the pesticides program dialogue committee of EPA, and that was a couple of years ago when this was being discussed. Many, of course, it was a committee of different stakeholders. Pesticides manufacturers were part of it, and several of the nonprofit groups and pesticides advocates. We, as the nonprofits, spoke very strongly about, banning it, and especially talking about how it harms children. And, same thing, I think we had several discussions at the EPA Children's Health Protection Advisory Committee when I was serving it. So clearly, these need to be banned. And I think groups like ours will continue to get to that point. And I think we have an opportunity during this administration to make more progress in this area.
Thank you, Leyla. And Jimmy, please, yes.
Sure.
I know you have a lot to say on this topic.
Well, I would agree with that. I think that, as you said, there's a lot of progress to be made. I think we got to start, though, with remember that a number of years ago, it was already banned and discontinued for home use.
Mhm.
There are plenty of studies, plenty of evidence. If you look at the cohort studies in New York City, the cohort study in California among farm worker children, there's a lot of evidence that there's significant damage in children at lower, what we would have considered lower levels, where by that I mean levels that wouldn't necessarily result in acute poisoning, but plenty of evidence that reports that they have significant cognitive delays, ADHD, autism. There's some new, the CHART study and some other studies that are looking at potential causes for autism, and numerous pesticides are actually showing up in some of the causation, or at least the association of those outcomes. The data continue to come in, and I think if you look back at what the EPA's own scientists had said a number of years ago, they had recommended a ban. With all that said, I think looking at the entire class of organophosphates, they're a much more toxic insecticide than other potential insecticides that we have available on the market. There's several different classes that are relatively newer insecticides that have much higher affinity for insect receptor sites than human receptor sites. And so there are alternatives. There's not a good reason to continue to use these highly toxic pesticides.
Yep. Very well said. There's no other case to be made otherwise. So glad that we collectively have so much of a great amount of skill on our board within our advocate community, because I do believe that we'll be ramping up a lot during this administration. And there is this large pesticide bill related to pesticide exposures in children being reintroduced that CEHN will certainly be a part of advocating for. So more to come on that front for sure. So switching our last couple of questions here, for example, COVID, we've all been living through this year. I say a lot that the COVID pandemic has only, if you will, ripped off the Band-Aid to a lot of pre-existing and long-term challenges that we've struggled through in this country. Injustices, our fence line communities are almost equal to our essential worker community. And these are communities that have been overburdened by a lot of environmental hazards, along with a lot of other social ills in many cases, which do harm their health and well-being generational as well. How have you all, for what you're willing to share, been impacted this year, personally and professionally, by COVID? And are there any pieces of this whole paradigm shift that we are trying to shift here that have really been exposed for you, maybe in a different way, or maybe have been exaggerated or brought to light for you even more?
Well, I guess I'll start this one. COVID has been certainly a game changer in the field of medicine. The vaccine has been so important. Get the vaccine. It's enabled us to really deliver the care again, and I think improve as a country. There may be hesitancy in the world. Those of you who don't know me, that's fine, but maybe you'll take my word for it.
Thank you, Jimmy. And Leyla?
Oh, thank you, Jimmy, for giving that message. As a trusted messenger, I'm sure that's going to go a long way. Yeah, I mean, of course, this is a quite a challenging time for all of us, personally, and as the communities and countries and globally, I mean, on and on. And I think we learned a lot from it. And we found out that actually we don't know anything.
Yep.
Uh, and that's one of the reasons I think we created this thing called vaccine hesitancy, because we're learning as we go along. And normally, people trust these scientists to an extent and their healthcare providers to have the answers. Well, in this case, we don't have the science yet to have those answers. So we are confusing the public, even leaving aside some of the misguidance that happened prior to 100 days. But we know that already people are, have their own way of looking at things. They don't always, agree with everything that is science-based. But I think in this case, it's much harder because we're just learning as we go along. That doesn't mean people like yourself or those of us who are really following the science, the best science, cannot develop their guidance like the CDC and other experts. And we have to follow those. And as you said, vaccination is critically important. And hopefully people will figure that out. And I think the government is finding ways to communicate, at the community level through trusted messengers. And we're hoping that we will be able to reach a point where we're not so scared anymore. But again, this is not going away, as we all hear. And I think I'll just conclude with this. I think the biggest lesson should be, it has been for me, is we have to have humility and we have to take responsibility. What I think this exposed is that, we've made a lot of mistakes as humanity, and we've left a lot of folks behind. The injustices continue, as Anse said. And we thought that we could control nature. And here we're finding out that we don't. And there is a lot more that we do not know. So we need to learn to respect each other and respect nature, and try to uplift everybody and be a little bit more humble in the way we're trying to control the environment and people who do not have power. Thank you.
Yeah, thank you very much.
One other thing on that makes me, also reminds me, the quickest they'd ever discovered, or the quickest they ever figured out a vaccine was the MMR vaccine. And it took 3 to 4 years to develop it. So this one took a year or less, really. And so I know people are worried that, that happened so fast, but it was so many scientists, so much effort, all concentrated in one time, that I don't think it was rushed. I just think it was really well put together and very efficient. So,
and also the technology was already there.
Yes.
mRNA technology was already there, and they just applied it to this. Well, it was quickly done as far as the clinical trials. Normally, we would have years and years of clinical trials. But again, that doesn't take away from what we know right now. And what we know is that we need to get vaccinated.
Yes. Thank you. Yes, and as we're wrapping down here for our final question, what might be some advice or words of wisdom you may have for anyone out here listening who may have an interest in connecting with the Children's Environmental Health Network, or having other ways to connect in this field of protecting children from environmental hazards? Jimmy, you have some thoughts?
All right. So I think as board chair, I would be remiss if I did not say, please consider your donations to Children's Environmental Health Network. It is a nonprofit group. They do amazing work, and they're always, working on finding the next grant, working on the next project. But for a small staff, they just get so many things done, so many things accomplished, and they're great stewards of the money that they receive. So, consider certainly your donations, but also consider checking out the website, seeing what's going on in the network. And, there may be other ways to help out. There may be, some children and teenagers out there that want to put together some nature and environmental projects. Well, we actually have an environmental project award for children and teenagers. And I think for healthcare providers, maybe watching this, always think of, in your patients that you see, how does the environment affect your patients? And you might actually find some benefit just kind of doing more of an environmental history and kind of exploring those issues. So.
Thank you very much, Jimmy. And for those listening, we do have a communication list. You can join it easily through our website or send any of our staff a message, and we're happy to add you to that as well. Leyla?
I'll add a couple of things, and again, repeat, please go to the website and you will see all the wonderful tools and resources that, where some of them were mentioned and some of them are not. Please feel free to reach out to us if you want to partner with us in any way. And also just want to mention that, the Children's Environmental Health Network is the organization behind the Children's Environmental Health Day. And that is celebrated every year on the second Thursday of October. And in fact, we pretty much celebrate all month of October because it's Children's Health Month. And there's a lot of activity around it, but especially Children's Environmental Health Day is a very robust, active day where we have an award ceremony, as mentioned by Jimmy, for leaders in this field and also young people. We actually, are really excited about announcing some of those awards. Plus, we work with communities for them, and you will find all of this on the website. You can sign up as a community partner to do your own things during the Children's Environmental Health Day. And and also we are actually, we have been collecting proclamations from local communities and mayors. So that's another way you could partner with us. And I'm sure I left out a few things, but please take a look at the website and reach out and sign up for the listserv.
Thank you so much, both of you. Yes, we have partners we're looking for, official partners for Children's Environmental Health Day. And please just reach out. Christy Truesdale, our deputy director, helps to lead all of that. We'll have calls and get you all organized, but just helping us market the day and helping to maybe organize an event or two, or align work you already have plans, reports you might have coming out, or anything else in the fall time. We'd love to hear about it. And we want to make sure that we put it up on our list of events. Events become very motivational for other parts of the country. When folks are trying to think about what they can do, even if they have a little bit of time or a small number of volunteers, or maybe it's just one person, there's always something that you can do with and for a young adult or a child to benefit their health and well-being today and into the future. And that's what this day is all about as far as organizations and individuals. We all have a role to play, and we all can join our voices collectively. And this movement is growing. It's getting bigger each and every year, including internationally. So we welcome you. I'm happy to answer any questions you have. And there'll be a lot going on in the fall as well as the rest of the year. So we definitely will keep you busy.
And for you, Nse, congratulations on 20 years at CEHN.
Thank you, Jimmy, so much. It's been quite a ride, and I've had such a pleasure doing these interviews each and every month. I think I've got one more left to round out the year next month, but it's been such an honor. I just can't say, this was so much fun. Leyla and Jimmy, thank you for taking your time to do this and to share some of your personal stories, your professional journeys, your perspectives. It's all so valued, and I know everyone listening really appreciates that too. So,
Thanks for having
Thank
us.
you very much. Thank you. And it has been a great pleasure to work with both of you, and looking forward to many more.
that's right. Got a lot of work to do.